Throughout this procedure, I'm going to demonstrate how I would administer oral medications. At the beginning of my shift, I would check the physician's orders, and I would check for the patient name and the patient identification number. The physician orders that today on April 8, 2020, that I administered captopril 25 milligrams by mouth 3 times a day for hypertension and ciprofloxacin 250 milligrams by mouth every 12 hours for a UTI. Throughout this video, I'm going to demonstrate the 3 checks and the 10 rights of medical administration. So after I have checked the physician's orders for the day, I am going to go check the medication administration record. I'm going to make sure that I have the right patient, and I'm going to identify by using their patient identification number. And I'm going to start by the first check. So with the first check, I'm going to check for the patient's name, the medication, the dose, the route, the time, and any drug allergies. And I'm going to determine what time they are due. So the medication administration record here says that on 4/8/2020, I need to administer captopril 25 milligrams as a dosage. The route is by mouth, and the time is going to be at 9 a.m. and it's for 3 times a day for hypertension. And also, I'm going to administer ciprofloxacin at 9 a.m. as well, and it's on 4/8/2020. It's going to be 250 milligrams by mouth every 12 hours for a UTI. And I'm going to verify that prescription, and when I verify it, it also includes the patient's name, identifier, medication name, dose, route, time, and always check for patient allergies. So I'm going to follow agency policies. Depending on your agency, some agencies allow you to administer medication 30 minutes before, but you do not pre-pour medications. So I'm now going to perform hand hygiene. I have obtained a key, and I'm going to unlock the narcotic drawer or cart, and I'm going to put the medication dispensing computer. Okay, I'm gonna select the prescribed medication. So here I have ciprofloxacin and the captopril, and then I'm going to sign out medication when administering a narcotic. And when I sign out, I'm going to include the patient's name, the medication, the drug dose, and other information depending on your agency. And then I'm going to count the narcotics when after I have removed what I need. So after I have selected the prescribed medication, I'm now going to compare it with the MAR. So I'm going to compare it together, and I have captopril 25 milligrams by mouth. It is for hypertension, and ciprofloxacin 250 milligrams by mouth and for UTI. And then I'm also going to check the MAR for any drug allergies. In this case, the allergies are penicillin. And I'm going to compare the MAR for the first 5 rights. So make sure I got the right patient, and then I got to make sure I have the right dose, the right drug, the route, and the time. So I will administer this at 9 a.m. And then before I administer, I'm going to identify the patient by checking their ID band and having them state their name. And then I would calculate this dosage accurately to make sure it's accurate. I will check the expiration to make sure that they have not expired yet. And then after I have done that, I'm going to do it. So now I'm going to start with the second check, and I'm going to verify the correct medication, dose, route, and time against the MAR. And then after that's right, I'm gonna lock the medication drawer. So now I'm entering the patient's room and I'm gonna prepare to administer the medication. I'm gonna perform hand hygiene. I'm going to check the MAR again, and this is gonna be my third check. I'm gonna check for right dose, right patient, right route, and right time, and then the right reason, and the patient has the right to know and the right to refuse. And then I'm going to check for any allergies again, and then I will perform any assessment if needed. I'm gonna explain my role to the patient and teach about what the medication's for, and now I'm gonna administer the medication. So I'm going to lift the bed up, and I'm going to ask the patient again if they have any allergies. I'm going to provide water, and in this case they're tablets, and they are already unit dose, so I do not open the package. I would just give it to them. If they have trouble swallowing, I would see if I could crush it or if it could be mixed with soft food, and then I would complete any pre-assessments if needed again, and then if the patient needs help, I would don on gloves and put it on the lips of the patient and tip the tablet into the mouth, and then I will stay with the patient until the medication has been swallowed, and then I would perform hand hygiene. I would lower the bed, and then I would place the call light within reach, and I would ask if the patient has any questions.